Hi guys, this is Doc Kriz, your online family doctor, making medicine easy for you to have a healthy life. Siguro tawagin na natin itong isang Q&A with Doc Kriz. Itong video natin about your questions, your queries on TikTok, pwede na rin siguro on YouTube kasi I will be planning to upload these videos also on YouTube para maka-increase ng engagement at the same time reach for your inquiries regarding medical health. Okay, let's start first with this question from TikTok. No, from Sir Bato or Ma'am Lon Melon. So sabi dito, ako po first time mareresetahan ng Chalmosartan. Pag sa doktor, mataas po ang BP pero sa labas, normal naman. Pati sa sekretary niya, normal. Pero pagpasok ko sa clinic kay doc, mataas daw. Now, the sheer description alone, I could tell that it's a phenomenon that is usually seen in the clinics. We call it your white coat hypertension. So, sa sitwasyon na ito, whenever a patient steps foot inside a clinic or in front of a doctor that is wearing his or her white coat, yun yung usual typical na features or scenario, nag-trigger siya ng certain increase of blood pressure. Ewan ko ba, siguro sasabihin niya sa doktor niya, nakaka-high blood ka, dok. Pero kidding aside, meron nangyayari dun sa situation na yun or confrontation na yun. Your patient is usually presented with an elevated blood pressure in the sight of a healthcare worker, be it a nurse or nursing attendant or even the doctor itself. No? So dun sa sitwasyon na yon, nagkakaroon ka ng elevated blood pressure pero pag umuwi siya, normal ang blood pressure readings niya. So white coat hypertension is a known phenomenon and it's already recognized within the realm of various clinical practice guidelines. But what can we do? How can we distinguish white coat hypertension from the regular types of hypertension na kailangan mong gamutin? Because if it's white coat hypertension, we have to delineate, is it really essential hypertension or hypertension that needs treatment, or there is another background player behind this type of elevated blood pressure? Now, going back sa description ni white coat hypertension, babalikan mo rin kasi yung environment ng pasyente mo. Your patient, let's say for example, may have a high stress work or workload, no? And then constantly anxious siya and siguro on the go lagi, often drinking caffeine or drinking carbonated drinks. Tapos at the sight of something that can trigger, okay, his emotions and even his fight or flight events, kapag nakita niya si doc, tumataas ang blood pressure niya. Dun sa time na lang siguro paglabas din ng blood pressure at nakauwi. Ay, paglabas din ng clinic, nagkakaroon na ng decline or normalization of your blood pressure. Now, paano natin madidetermine kung high blood ba talaga ito or white coat hypertension lang? So, ang kailangan natin gawin, most of the time for me in my practice, I would request for a 24-hour ambulatory blood pressure monitoring. So, this type of procedure, may kinakabit kami sa pasyente. Nilalagay namin siya either on the waist, pero meron siyang cuff na nakamamonitor sa blood pressure niya 24 hours. So, ipapauwi namin sa pasyente yung device. And then, after 24 hours, babalik siya at ibabalik niya yung device sa clinic for official reading. Now, the readings will be interpreted by a physician and will determine if meron talaga siyang peaks of elevated blood pressure even at home. No? So dun sa sitwasyon na yon, we could fully determine if the patient really has hypertension that is primary in nature and can be managed accordingly with medication. Pero, let's say for example, normal pa rin ang blood pressure niya even with 24-hour ambulatory blood care or blood pressure monitoring. It's safe to say that we need to process things that is present in the patient's lifestyle. Specifically, how to manage stress, how to manage certain situations that might lead to anxiety and can lead to distress during times of confrontation. Kasi kung nagkakaroon ng confrontation with a doctor, natitrigger siya agad-agad ng any form of elevation of blood pressure. So we need to find ways that the patient can relax. So there are a few tips na pwedeng banggitin or sabihin or ipayo sa pasyente kapag nakita natin or distinguish natin na pwede siyang case of white coat hypertension. The number one is when you check your blood pressure from time to time, kasi minsan hindi lang yung doktor yung nag-trigger, yung blood pressure monitoring or yung pang-BP mo sa bahay, nakakataas din ng BP. The sheer event na nilalagay mo sa arm mo yung blood pressure cuff, nakakataas na ng BP kasi naninervyos ka na kung ano yung result, di ba? So, siguro ganitong gagawin natin, no? Check your first blood pressure, then after 1 or 2 minutes, do another reading. So this is the 2 reading rule. Most of the time, you are anticipating na mataas ang BP mo, kaya yung first reading is usually higher. Okay? Then you get the second reading. The second reading will already prime you. Kumbaga, na-prime ka na, ito yung baseline reading ko ng first reading. And then the second reading, more likely you feel relaxed because the blood pressure might even decline after the second reading. Siguro after 1 to 2 minutes ka nag-read, check your blood pressure, and then nag-normalize siya. Well, that might either be triggered initially by an anxious response, di ba? So, mas mainam that you record both para makita mo din. And may pakita mo rin sa doktor na you have episodes na mataas ka at first and then secondly, normal siya. Okay? But if you're still undecided kung ano ba, may high blood ba ako o wala, go to your doctor. Patingin pa rin lagi. Kasi it's important na mag-guide kayo ng maayos at kung kailangan kayo mag-start ng medication, nag-guide kayo ng maayos ng isang doktor. And again, do not self-medicate. Self-medication is hazardous, lalo na kung walang supervision ng isang healthcare provider or healthcare physician, specifically a licensed doctor. Okay? Huwag basta-basta kumuha ng gamot sa RHU, huwag basta-basta kumuha ng gamot sa butika diyan sa barangay health center without any guidance and supervision from an RHU doctor. Okay? Hopefully, may natutunan kayo sa video na ito. White coat hypertension. White coat hypertension, mataas ang BP pagkaharap si doc, pagkaharap ang BP, pagkaharap ang isang nurse, or parang nasa loob ng clinic, mataas. Pero pag uwi mo sa bahay, normal. What to do? Seek consult with the doctor, may request for a 24-hour blood pressure monitoring at the discretion of your doctor, and see if you really have hypertension or just factors of anxiety relating to white coat hypertension. Again, it's important to seek consult with your doctor before doing any management. Follow me for another video later. Siguro, discuss natin the difference with white coat hypertension and mask hypertension. Because it's interesting enough na magkaiba ito, pero most of the time, pareho sila ng management. Okay? And again, thank you for always supporting this channel and also the videos that I post. Please support every health related content that we post and also other Pinoy related health content providers, specifically doctors that provide meaningful health education, such as me and also other doctors that are trying to rid of misinformation in social media. Again, this is Doc Kriz, your online family doctor, making medicine easy for you to have a healthy life.